Hello everyone, our topic today is going to be on sertraline or Zoloft, and the authors of this presentation and our paper are Addison Bryant, Emily Feldberg, and Sophia Reines.
What is sertraline or Zoloft? The generic name for this medication is sertraline, and the brand name is Zoloft. It is approved by the Food and Drug Administration, known as the FDA. It is also classed as a selective serotonin reuptake inhibitor, known as an SSRI. The tablet can be identified from the 25 milligram tablet is light green, the 50 milligram tablet is light blue, and the 100 milligram tablet is light yellow. There are also some SSRIs that are other alternative medications. These include Celexa, Lexapro, Prozac, Paxil, or Paxava. These are different medications, also known as antidepressants as well. What is sertraline or Zoloft prescribed to treat? This SSRI is prescribed to adults and adolescents to treat depression, anxiety disorders, obsessive-compulsive disorder or OCD, post-traumatic stress disorder, PTSD, premenstrual dysphoric disorder, PMDD, as well as postpartum depression, as well as anxiety. It is prescribed to postpartum mothers because it is considered to be a low-risk medication to infants, so it is considered safe for breastfeeding mothers to take it. Sertraline is one of the first antidepressants that are prescribed to women suffering from postpartum depression because infant serum levels are undetectable even when breastfeeding. Protein binding impacts the ability of drugs to transfer into the breast milk. Because sertraline or Zoloft is 98% bound to plasma proteins, it decreases its ability to transfer. These are just some of the considerations that doctors and patients must make when discussing what dosage to start with, as well as the maximum dosage that is considered safe for that individual. The maximum recommended dosage for all individuals, though, is 200 milligrams per day. A person is at an increased risk of experiencing side effects of sertraline when they're starting the dose, stopping, or changing the dosage. If you look at our handy pyramid of side effects, we have common, which affect 1% to 10% of users, include aggression, anxiety, abnormal vision, erectile dysfunction in men, diarrhea, dizziness, drowsiness, fatigue, headache, nausea, nervousness, nightmares, tremor, or suicidal ideation. Uncommon side effects occur in 0.1% to 1% of users, include abnormal dreams, poor coordination, alopecia, amnesia, anemia, chills, ear pain, hallucinations, or muscle twitching. Rare side effects are less than 0.1% of users are anaphylactoid reaction, bradycardia, hypoglycemia, increased libido, suicidal behavior, or rare serotonin syndrome. As we said, it is important for the user to contact the prescribing doctor right away if they experience any of these side effects. And for the more rare and severe side effects, they need to go to a closest emergency room or dial 911 if experiencing them. In a generalized anxiety disorder randomized trial for adolescents, significant improvement was measured after 9 weeks of taking 50 milligrams of sertraline a day when compared to the control group. This supports that it may take a few weeks for side effects to wean off, but it will take around 6 weeks or longer for the actual effects of sertraline to kick in. The doctor should also give a list of instructions on what to avoid when taking this drug. Some prescription drugs like tramadol may increase the risk of serotonin syndrome because they increase serotonin in the body, as well as herbal remedies. So it's very important to be in good contact with your clinician during this time. In clinical drug interaction studies, no drug has been identified that can cause a large increase in sertraline exposure, though, by inhibiting sertraline metabolism.
How does sertraline or Zoloft work? Sertraline is classed as an SSRI and works by increasing the amounts of serotonin or 5-HT in the brain through inhibiting receptors. Serotonin is one of the chemical messengers or neurotransmitters that carry signals between the brain nerve cells or neurons. SSRIs block the reabsorption or reuptake of serotonin in neurons. This makes more serotonin available to improve transmission of messages between neurons. SSRI's beneficial effects is based on the gradual downregulation of the 5-HT transporter that has been reported to occur over the first 2 to 3 weeks of SSR treatment. Having more serotonin available is important because anxiety-like behaviors are associated with decreased levels of serotonin in the medial prefrontal cortex. SSRIs differ in potency at blocking serotonin reuptake and how quickly the body metabolizes the drug. It is hypothesized that all SSRIs work in similar ways and they can cause similar side effects. However, if the patient cannot tolerate one SSRI, they may be able to tolerate another. Other alternative medications were previously mentioned, but they can include Lexapro or Prozac.
So you may wonder what this looks like, and here we have 2 pictures. The top picture is the SSRI in action. It's inhibiting the reuptake of serotonin. And the bottom picture is the result of this is in the synaptic cleft, there are more serotonin available. So this is just what a picture of what's going on so you can kind of get a visual on it.
In a study completed by a team of researchers, the effects of long-term use of sertraline on neural volumes in depressed and non-depressed monkeys was evaluated over the course of about 3 years. During the first 18 months of this trial, the monkeys lived in social groups of about 4 to 5, and depressive and anxious behaviors were observed and recorded. For this study, depressive behaviors were defined as slumping posture, often head to chest, with eyes open to distinguish from resting behavior, and a lack of responsiveness to environmental stimuli. While anxious behaviors include scratching and self-grooming, like combing skin, hair, teeth, or nails. At the end of the 18 months, monkeys were assigned by social groups to either placebo or sertraline treatment. Both groups were treated for another 18 months, and behaviors indicative of depression or anxiety were recorded twice a week during 10-minute focal observations during the last 12 months of the 18-month treatment. It was concluded from a study that sertraline has no effect on rate of depressive behavior, but had significantly reduced behavioral indicators of anxiety. Post-HOC tests suggest that in the placebo groups, depressed monkeys had a smaller left anterior cingulate cortex volume than non-depressed monkeys, and that in the depressed monkeys, sertraline treatment resulted in a larger left ACC volume. The ACC is responsible for complex cognitive functions like empathy, impulse control, emotions, and decision-making. There were no significant main or interaction effects of sertraline or depression observed in the left ACC, as well as in the whole amygdala or left hippocampus. Post-HOC tests showed that among non-depressed monkeys, those treated with sertraline had smaller right hippocampus volumes.
Absorption, distribution, and excretion in the human body. This is absorbed while passing through the digestive system and into the bloodstream, then onto the liver. Multiple studies have found that cytochrome P450 enzymes in humans, which are found in the liver primarily, may be responsible for sertraline metabolism. Also, the individual's P450 enzymes will metabolize their sertraline at different levels. So each enzyme may be doing a higher or lower amount throughout different individuals. So this supports the theory that individuals will react differently to this medication, both metabolically as well as psychologically. So because of this, doctors can sometimes order a blood test for their patients that may offer clues on how their body will react to this medication. Distribution. The circulatory system carries the medication through the person's bloodstream, and the peak times of this is 4.5 to 8.4 hours after taking the medication. Excretion is the N-desmethylsertraline is deaminated into desmethylsertraline ketone. Then these metabolites are also excreted into the urine as well as feces.
For the next topic on Zoloft, it will be interactions with other medications. The interactions and effects of taking other medications with Zoloft include decreased Zoloft effects, how long the Zoloft works for. It also increases the side effects that we talked about earlier. It decreases the effect of the other medication that you are also taking. And while taking Zoloft, you should avoid alcohol, legal and other recreational drugs. Because certain medications can react with Zoloft, it will cause the unwanted side effects or cause the medications to be more or less potent. Because of this, you should not be taking another type of antidepressant while taking Zoloft. And taking it with other drugs that can affect the serotonin, and it can increase the risk of serotonin syndrome. And this syndrome involves a range of symptoms, including loss of muscle coordination. So, what are some tips and tricks while taking Zoloft? The very first one will be consistency. And what exactly does this mean? Well, you need to administer Zoloft once daily, either in the morning or the evening. If Zoloft makes you drowsy, take it at bedtime, and it may be taken with or without food. However, this has to be consistent daily. Talk to your doctor if your mood worsens or you experience any suicidal thoughts, particularly during the first few months of therapy. You need to seek urgent medical advice if symptoms consistent with serotonin syndrome develop, and that's why you need to know more about serotonin syndrome. And do not stop taking suddenly, as withdrawal symptoms may occur. When this time comes to discontinue Zoloft, you will need to be advised by your doctor to either stop taking it or taper down your dose. And you need to report any problems with bleeding or bruising to your doctor, and report any unexplained skin changes. These changes can either be blisters or rashes. You can have problems with urination, eye pain, or swelling. And if vision changes occur, talk to your doctor. For the oral concentrate of Zoloft, you need to dilute it immediately before use with either water, ginger ale, lemon lime soda, lemonade, orange juice, but you have to take it immediately after mixing. And lastly, for people who are allergic to latex, note that the Zoloft oral concentrate dropper dispenser contains latex. And those are the tips and tricks that I have for taking Zoloft. There are multiple ways to pay for this prescription drug. There is a name brand and generic brand of Zoloft. Many insurance plans will cover the cost of the prescription drug. It is also covered by Medicare. And if you don't have insurance, there is also a good website to use for coupons in order to cut the cost down of the Zoloft itself, and it is called goodrx.com. The numbers that I have up on the screen are for cash paying customers only, due to the fact that insurance does cover this medication. So the oral concentrate is $261.37, and then the tablets, the oral tablets, can range from $139.01 to $375.88. And the affordability really only depends on your dosage of how much of the Zoloft that you actually need. So it's just dependent on how many milligrams you need will be how much you pay for your prescription. And lastly, this is just our reference list, and we would all just like to thank everyone for coming to class today and listening to our presentation. We really hope you learned a lot about Zoloft. Thank you.